government, and this is about the last that I've got. Government can be ponderous and slow, but at least people have the opportunity to change what they feel is unfair or wrong through the ballot box or by applying public pressure. Public pressure is something like civil disobedience that happened during the Civil Rights Movement, and it also happened during the Vietnam War, which brought an end to the Vietnam War. In contrast, patients have little or no ability to influence the politics of such investor-owned giants such as United Healthcare or Aetna, and unfortunately, America's current political system gives corporate lobbyists an advantage over the public in influencing government policy decisions. In other words, as long as we have a fragmented healthcare system, everybody it's chaos, and everybody is on your own. And if you have money, you can hire the lawyers, you can pay for your health care. If you don't have money, our system is predicated on having money. Sure, if you don't have money, you won't get care. And these are the fundamental questions that need to be addressed about health care. So,
okay.
I can't stay short.
Why don't we just kind of gather around the circle tables here? Have a little time to share. Now. Yeah, interested to share that came from you or your partner. Or partners. I know you had 3 over here, so you guys had to kind of play funky with it. Anyone? Right. Look at the first question. Human right or a commodity? Talk about that together with your partner. Yeah, like, we're going to do these quick because we're on the edge of our time, but we don't have time. First question, do you think it's a human right, or is healthcare a commodity that you buy or sell?
What it should be or what it is?
Exactly.
What it should be. We're going to go with what it should be.
What it should be?
Yeah.
Should be.
Right. So I think I already know what this conversation was leading, but go ahead and talk with your partner. Give you like 1 minute to talk on that question. The story of a leper that comes to Jesus saying, can you heal me? Can you cleanse me? And Jesus is deeply moved, puts his hand on him, and he says, I want to be clean. And the leprosy was gone. His skin was set right. So Jesus told him, go to sell nothing to anyone. Take the offering for cleansing that Moses prescribed and present yourself to the priest to validate your healing to the people. But as soon as the man left, he went and told everybody what he had heard. And so Jesus had to stay out of the way places and couldn't even move freely in or out of places, because whenever people heard about it, they would come from all over after this. So it's the story of Jesus cleansing this leper. And I want you to take 1 minute just to talk about how does this fit in with the question we just had about healthcare's right or commodity. Kind of how does our faith then fit in? You know, where is Jesus in all of this? So go ahead. Leprosy, we often think of leprosy as a skin disease, that your hands start going numb, your skin kind of just sort of falls off. But leprosy was many different things in Jesus' day. Any kind of skin disease, even if it was just like a modeling or something, could be considered leprosy. And the priests had the control over who was in or who was out. And if you were called a leper, you were out of society. You were not connected with anybody. You couldn't be around people. So when this is saying the leper comes to Jesus, he might just have something like that he's kept out of society because of. But when he comes to Jesus, it's kind of interesting. He sees Jesus as this leader, and he says, if you want to, you can cleanse me. So there's a sense that this guy doesn't trust that the people who are in charge of things, the leaders, are really for the people. So he's kind of not even sure Jesus is for him. And when this deeply moved, this can also be translated as basically very angry. That Jesus was deeply angry. And sometimes people think it's about the leper. But if you read on, what Jesus says to do is after he heals him, he says, you are to go to the priest and take your offering that Moses prescribed and present yourself to the priest. And what most translators think this means is Jesus is saying to the priest, who are supposed to decide if you're clean or not. He's not saying, go and let the priest decide now if you're clean. Go and tell him that I made you clean. Right? But the point is, Jesus is saying, he's not really in charge of the system. Go and tell him that things have changed. right? So priests who are rich and powerful can control the system of, in essence here, what is healthcare and decisions over health. Jesus is telling them that I'm in charge now. So in your last minute, talking to your partner, how does this change how you think faith affects our issues with our discussion of healthcare?
Some things change, because I know one of the things that I just learned this week from the farmer, I went back to the farmers.
Right.
Place, and they had, they said that for your health care, because it costs like $500 or more bucks to be part of a co-op.
Right.
For organic foods and to eat more healthy. But some insurances they've been pressured into now, making an allowance. You get a rebate for wellness dollars, if you will, by joining a health club and exercising or doing certain things, doing, wellness testing. They've now added, some have now added, they will pay like $200 towards a co-op membership to have more healthier eating.
Wow.
Not all of them, but so some things may change, but it's still not changing the whole system at a monetary level.
So maybe
for
part of
what
our
everybody
discussion
needs.
next week could be, how do you begin to affect the system? Right?
And to do it more globally.
Lord, have mercy. All right. The Lord be with you.
With you.
Thank you. Let's pray.